of the recent documentary that we are now sharing far and wide in terms of our Armed Forces project, which is particularly around our prevention and intervention for gambling harms for serving personnel and our veterans community. I want to share a little bit of history because we're going to talk a little bit about our own life experiences, but particularly in terms of my investment and my affinity with this particular group. On the 17th of October 1939, the SS Yorkshire was struck by U-boat 37 off Gibraltar. It was the first Liverpool-based Bibby Line ship to be torpedoed in the Second World War. George Dixon of the Duke of Lancs Regiment, with his wife Bridget and his children Cyril and Maureen, were the only whole family to survive that day. George was my great-granddad, and Maureen was my maternal grandma. Everything they had and owned went down with that ship, and it was only actually at the age of 89 I heard the whole account of that day in full detail when she shared it with the Merseyside Maritime Museum as one of the last sole survivors. I think because of what I was doing in terms of work at the time, that was my first acknowledgement of the recognition of trauma and actually how our previous generations have dealt with that through their own mental health and breaking down the stigmas of how we share these accounts. And that's particularly poignant in the work we do today, and particularly with this piece of work. And it's probably this family history which means I have such a great affinity and respect for armed forces and the wider perception of the risk and sacrifice that they give every single day. But I'm also a former military wife, and I also have a great understanding of the impacts and challenges that it has on family life, and that's without gambling-related harm. And that's something I've also experienced as an affected other, and that has changed the course of mine and my family's life over the last few years. So what we're seeking to do, particularly with our Armed Forces project, is through education and prevention work, support and stir an institutional change across all our systems, both the third sector and our public health. So with that, I'm going to let Andrew speak a little bit about his own experience, and then we'll talk a little bit more about the project.
Thank you, Nicola. So take over from that. So Andy Stoneley, so my current role is Armed Forces Training Education Lead for this Armed Forces network. Veteran, so served 23 years. Throughout that career I struggled with gambling-related harm, which I managed to hide from my family and colleagues, etc. Where a successful career reached to, for the ones who know the rank. But a show of hands, has anyone served in the military or a veteran in the audience? Thank you for your service, or even families out there. Yep, thank you. So 23 years, got to the ones that know the rank, got to Warrant Officer Class 1, which is the senior soldier rank of the military, where I then came across, borrowed some money, but gambling, asked for help, and then wasn't really recognised straight away. It was straight with the Royal Military Police for that poor conduct, as they said, which was called dishonesty, which then brought me to borrowing about £5,000, which brought me to Military Corrective Training Centre, which is the military prison, where that literally turned my life around. So asking for help there, which was you could say, defined as rock bottom. But the work we're doing now, it doesn't need to be the rock bottom. With this training support we're doing, we can get the early intervention and the train out there. Married man, basically, who wears his heart on his sleeve, literally left my wife, 3 children with no money in MCTC, so same as a prison, literally no salary, but use that rehabilitation process with Ian and his team that turned my life away, and this opportunity through Neil and Ian to make the difference to them service personnel, that where, if you know a little bit more, the risk is already there in terms of the risk they take. We don't know what the landscape looks like now with what's going on across the Middle East, Ukraine, Russia, etc. But I served two 6-month tours in Iraq, two 6 months in Afghanistan, and unfortunately that makes you a strong person, but gambling, it can attack anyone like it did with me. So lived experience is there, and making that difference now for young service personnel across the tri-service and families, that literally the support is there at the early intervention, and you can change your life. And if it's criminal like mine was, which was fraud by misappropriation to bring me to the Corrective Training Centre, you can turn every negative into a positive. So that's my lived experience, which I share on all the training we deliver, which we'll mention in a minute. hopefully that will give people the confidence with the stigma, because like a lot of organisations, especially the military, the soldiers don't want to come forward because they believe they've let their cohort down, their team, but we're giving that awareness. Actually, there's a lot of strength in this, and actually, like you could say, there's no silly question, the support's there. So with a bit more information, well, that's my lived experience, and you can actually turn your life around. So back to you, Nicola. Thank you.
Yeah, so there's a couple of key arms to the work we're doing as part of the programme. The first thing to mention, obviously, in terms of our support and treatment across our partner agencies, is getting bespoke specialist treatment to any of our armed service, either serving personnel or that veteran community, with appropriate free and confidential support, so they have access to our entry to service at any time. But the key element is actually through our Bet You Can Help training programme. And this is really, as I say, about stirring that institutional change and building that curiosity and appetite for, as Neil was referring to, the screening and assessment for gambling harms, both through the actual military itself, but also those organisations and military services that support them. So Bet You Can Help is our level, which comes in two parts. It's RSPH accredited training that serves as sort of an introductory session for an hour and a half, or our level 2, which is tackling gambling related harm. So there's actually a certified certificate for those who take part in the training. Access to that is completely free and delivered, as Andrew says, through our team members. And we also can deliver that face to face. So what we're really wanting to do is reach out, have those conversations for any professional or any practitioner who may be, through their general day-to-day work, be working alongside those armed forces, and have the opportunity to upskill and build confidence really in the work that they're doing. So you can hit those early identified factors. You can look out for the risks associated. You have a bit more of an understanding in terms of the cultural landscape within our military as it exists today, which has also gone through a great change in recent years, but particularly picking up on the point that Andrew made on the end then, is about breaking down the stigmas. This is a very unique group in terms of how we speak, how we support, and how we access our military services. Is really a key arm of what we do. We're here to help you, and that's, you know, honing back particularly to what Neil said at the beginning. Let's focus on what we can do and how we can take this forward. So please, if you have any questions in and around the training or the actual support and treatment that we're offering, make sure that you ask us some questions.
I never got a chance to say it through COVID. I always listened to the news, didn't be next slide, but it was already there. So I'll stand at the side. I can talk quite loud as well. So the maps there are the team that support it. So top left there, Scotland there. So RCA Trust, we'll cover that geographically, so it shows there we cover the whole country. Northwest there through Nicola, we've heard from today, through Counselling Trust there. Wales and Southwest, okay, with Matt, Recovery for All. Top right there, Fiona with Bet No More. She's just had a promotion as manager and making her team there with Bet No More. And myself there for East England. Okay, with Breakeven. The main thing is that we've got that armed forces relation, whether it be serving, veterans, or even family wear through Nicola there, so we can cover the whole geographics. Working collaboratively together, so even though we have got our set areas, we will mix and support each other to give that collaborative approach. So it's across the whole country there for us to make every contact count. So contact details are there. We opened up with the Unseen Enemy. We had a really good second showing last week in London. We've already done Liverpool. There's 2 events coming up, I believe, in Bristol and Plymouth. Quite a far way today, but there'll be information to be shared for that. Had a great Q&A session. So any questions? Happy for us both to do a bit of Q&A for a couple of minutes. No such thing